Hi everyone, I'm Jessica. What I've learned about public health from chapter 1 of the textbook is that public health is made up of different programs that help to keep the community healthy through many different avenues. So, some of the ways that they help are through preventing diseases before they start, preventing the spread of a disease after it has begun, and lessening the impact that a disease can have on a community. Some of the ways that they do this are keeping the environment clean and improving sanitation in communities. They also educate the community about how to keep up with personal hygiene and inform citizens when there's an outbreak of a disease in order to increase safety precautions to prevent the spread. It is mainly the government that is involved in these public health programs. Because public health deals with the overall health of communities and not just individuals, the government, whether it be local or state, is the one that needs to make final decisions regarding certain programs. Whether they are also the ones doing the funding for these programs, so that they will not approve of ones that they deem unnecessary. I looked at two articles from the most recent issue of The Nation's Health. The first article I looked at is about the affirmative action ruling that could be threatening diversity in the U.S. workforce. The ruling put a stop to race-based admissions to schools like Harvard and the University of North Carolina. This will affect the job diversity in careers that need college education, such as the medical field. The article says that it is beneficial to have health professionals of different cultures and backgrounds because they can offer different perspectives that can help with diagnosis of patients. By looking at statistics, it was discovered that the life expectancy for Black Americans increases when their primary care physician is also Black. It is also assumed that with less minorities in the healthcare field, it may become more difficult for lower income areas to receive medical care. This article would belong to the public health science of statistics. The reason for this is because looking at statistics for minorities, their incomes, their life expectancy, and their college admission rates allow them to piece together issues that could arise from the termination of affirmative action. With this information, a plan can be made by public health professionals to further help communities that are struggling to receive proper health care. The second article I looked at is about laws arising from more fair work week hours that will be better for people's health. Unstable schedules such as those that are on call can cause sleep deprivation as a result. This can then lead to many different health conditions such as stroke, depression, and other chronic illnesses. Many people with unstable schedules also pay their bills late and don't have adequate medical care, which can lead to even greater stress and sleep deprivation. It has also been found that many workers do not know their schedules until 1 to 2 weeks in advance. This can cause disruptions in the home and cause parents to need to leave their children home alone. Because of these issues, creating better work schedules has become a major public health concern. A new law was passed in Los Angeles that requires workers to have their schedules 2 weeks in advance and are required to have 10 hours rest between shifts where they work closing and opening. This article is an example of a social or behavioral public health science. The behavior in question is overworking along with sleep deprivation due to unstable working schedules, which leads to health problems. Public health officials are working to create new regulations that will eradicate this issue. The one law that has passed may not make much of a difference yet, but when employees start to realize that their rights are, I believe it will lead to more changes taking place.